Welcome everyone, and thank you for joining us for today's webinar on planetary health. My name is Molly Buss, and I'm the Community Relations Manager at the Earl E. Bakken Center for Spirituality and Healing. And my role for today's webinar is to moderate the chat as well as facilitate the Q&A at the end of the session. Before we get started, I just wanted to give a quick introduction to the Bakken Center for those that may not be familiar with our work. It is our vision to advance the health and well-being of individuals, organizations, and communities through integrative health and healing. And in an effort to make our programming accessible during the COVID-19 pandemic, we're hosting several free webinars and providing other online resources to help you take charge of your health and well-being. And I'll share some more information about those resources via email after the webinar concludes. Today, I am delighted to introduce Teddie Potter, Clinical Professor and Director of Planetary Health at the University of Minnesota's School of Nursing. And before I turn things over to Teddie, I just wanted to share a few logistical items to help you navigate the webinar functions. So throughout the session, you are welcome to share your thoughts or comments via the chat box. And if you're comfortable and want to share your responses with all participants, please make sure to update the to field in the chat box to all panelists and attendees. And note that you have the opportunity to minimize the chat box during the presentation. And we do invite for you to do that during the components that aren't interactive to help you stay present. There's a Q&A icon where you can submit your questions, which Teddie will do her best to answer as many as possible at the end of the session. If you aren't finding those icons, try hovering your mouse over the bottom of the webinar screen and they should pop up for you. As I shared, we'll be sending out an email after the webinar with a recording and also Teddie's slides. So without further ado, I will turn things over to Teddie.
Well, welcome to all the people that are here. I want to say a special thank you to the Earl E. Bakken Center for Spirituality and Healing for inviting me today. And I want to dedicate today's presentation to all of my nursing colleagues that are working very hard on the front lines, in addition to other health providers and people providing essential services. We know that these are very, very difficult times, and hopefully today's discussion will be about how we can put the earth in a healthier place so that severe pandemics like this don't occur in the future. So I'm happy to be here, and I'm going to be speaking for about a half hour and then opening it up for questions, and hopefully we can have a robust dialogue. And I especially want to acknowledge people who are coming in from places other than the United States. It's wonderful to have you be here, and I appreciate your being able to adjust to the time frame. So I hope to be, or I will be covering a little bit about the emerging field of planetary health, giving you some definitions of planetary health, describing the cross-cutting principles, and then I'm going to use the language of mitigation and adaptation to talk about how we can address the planetary health issues, and hopefully leave you with some takeaways on actions that you can do in your own personal life or your professional life. So before we even get started, what is this planetary health term? A lot of you might already be used to public health or eco-health, One Health, global health, and you might be thinking, why the heck do we need to have one more term? Aren't they all the same? And I just want to say that all of them are necessary, all of them are important. One is not more important than the other. So those of you that have been doing global health or One Health for a long period of time, keep doing One Health or global health. We certainly need you in those areas. It's all about percentages or titrations. So public health, yes, does acknowledge the environment, but orients more towards the health of humans out in the community. Eco-health or environmental health puts emphasis on the health of the environment and a little bit on humans. One Health acknowledges the intersection and connection between animal health, plant health, or environmental health, and human health. And global health certainly addresses issues related to broader issues across the globe. I'm saying that all of those fit under the broad umbrella of planetary health. Planetary health is a emerging field which acknowledges that there is a connection between human-caused disruptions of the Earth's natural systems and the impacts on public health. So where the other programs perhaps address the issues that have been caused, planetary health also looks at the root causes. What is it about humans and the way that we live upon this planet and the way that we interact with the other beings of this planet that set us up for health issues? It really holds our feet to the fire to say we are the cause of many of the health issues that are coming forward now. It is a relatively new term, and it began in about 2015 when the Landsat and the Rockefeller Foundation began to see trends. We were definitely seeing improvements in population and public health across the globe, but that was coming at an expense of disruption to our environment. So we began to recognize and realize that our choices and our actions had consequences, and that we needed to be looking at these consequences and factoring them into the choices that we are making. The leading article that you can go to for more information about how this started is Safeguarding Human Health in the Anthropocene Epoch. It's a report of the Rockefeller Foundation and the Landsat Commission, and it's a very comprehensive report. So essentially, it's this message from John Muir. When we try to pick out anything by itself, we find it hitched to everything else in the universe, in that we cannot see things in silos anymore or fragmented terms. Everything is interconnected. So here are some of the planetary health vital signs. These are just some of the disruptions that humans are causing. Water scarcity, changing food systems, and that involves food preparation, food growth, if it's agriculture or nurturing animals in the food system. And we're certainly seeing supply chain issues regarding that. Urbanization, the growth of cities and the destruction of forests and our ecosystems. Certainly a biodiversity loss. We're seeing a loss and an extinction rate that's 1,000 times the normal rate of extinction. Natural disasters, you can look up the number of billion-dollar disasters related to climate change. In 2019, there were numerous, but in the last 10 years, it's just been escalating. Certainly climate change has many issues that we know are human caused that we need to address. Land use, the coverage of land is causing problems with all these other issues. Global pollution, certainly we can put plastic in that area, the plastics that are in our oceans, the toxins that are in our soil and in our water, and changing biogeochemical flows. So what's happening? These are the human issues, the human caused problems, and how's that impacting human health? Well, we're seeing a rise in non-communicable diseases. We're seeing infectious diseases and pandemics. We're seeing mental health changes. Nutrition is impacted by these human behaviors, as are the health of our human cultures and civilizations. So we're seeing increased civil strife and displacement of people. This map here was from March, and it is the COVID-19 global map. So we're seeing that these human-caused ecosystem transformations definitely have an impact, not just locally or regionally, but across the entire globe. We look at COVID-19, we've all become very, very familiar with this picture, and it is one symptom of a multi-system failure. So I've been a climate nurse for a long time, working on climate change, working on building resilience for people. And I began to realize that climate was one piece of this entire system that was starting to fail. If for those of you in healthcare, the best analogy for me is it's as though we had a patient in multi-system failure. where the lungs are going down, the heart is having trouble, the skin is being impacted unless people are regularly turning the patient. Their renal function is shifting. Everything is collapsing at the same time. And unfortunately, our planet is in multi-system failure. So COVID-19 is a symptom of that. Climate change is a symptom of that. The collapse of our fisheries is a symptom of that. And we need to take this seriously, and we need to work together to try to solve this. It is so powerful and impactful that this is related to climate change, but the same could be said of all the issues related to planetary health. This is from the Landsat Countdown, which is an annual report. The 2019 report warns that the life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food, and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated interventions, this new era will come to define the health of people at every stage of their lives. This is important in a global level, and we can talk about numbers, but it certainly gets very personal. This is the backdrop of this quote. It happens to be a picture of my son holding my grandson. And when I look at what his future is going to look like, I'm throwing everything I have to creating a better future. I don't want him to be facing these predictions of the new normals of extreme weather, of food and water scarcity, of increased infections, of increased pandemics. I am going to do everything I can so he and children like him and his children and his grandchildren and children and grandchildren all over the globe have a chance to survive. So if I've done my work, I've convinced you, and maybe it doesn't take a lot of convincing these days, to see that we're in a mess. And we're in a mess that we have to work our way out of quite quickly. The Intergovernmental Panel on Climate Change's report from 2018 said we don't have 100 years to work on this. We don't have 50 years to work on this. We're talking about a decade to a couple decades to figure our way out of this mess. So that's one of the reasons I feel that I'm so committed to planetary health education. And I want to tip my hat and acknowledge the wonderful colleagues across the globe that are participating in planetary health, especially people affiliated with Planetary Health Alliance at Harvard. There is a group called Clinicians for Planetary Health, where people can sign up that are interested in planetary health and want to support that in their work. As I said, one of the reasons why I like planetary health so much and find it so useful is that it is an umbrella that tackles the root causes of these problems. For me, it's not enough to know that we've got problems, that we're in a mess, that we are having difficulty, that our very survival is threatened. That is not enough. I want to understand how we can work our way out of this. I want to understand how we can transform systems, transform relationships, transform the work we do so that we begin to set our feet on a more positive path. These are the Planetary Health 12 core cross-cutting principles. And you can see that these principles really tell a story of shifting our culture. So it's important for us to have a planetary health lens to understand that human health and the health of the environment are intimately connected. It's important to understand that this is urgent. This is a crisis. We need to be moving on this quickly. We need to be having supportive policies that help create and point us in the direction of a positive future. All of us need to understand how to build movements, how to encourage bottom-up solutions, that we cannot rely on our governments to solve all the problems. It has to be solved in addition to at the government level, but also at the family level, the household level, the neighborhood level. We all are in this together, and we need to know how to work together. We certainly need to know how to communicate with one another. And you would think that that would be something that we know how to do, but we just do not. And you can see with the COVID-19 revealing gaps in our ability to communicate effectively across sectors, across disciplines, across organizations. And so we have to be working on that. We have to be thinking in terms of systems. That statement of that everything is connected. We need to be understanding and really deeply grasp that things are part of one system. We also need to be transdisciplinary, meaning that we don't just work within the silo of one discipline, whatever discipline you're part of, but that you understand how kindergarten through 12th grade education is connected to people who are in agriculture, is connected to people who are in law, is connected to healthcare. We have to be working across sectors, listening to what each other is discovering, what each other's knowledge is being developed, the science of each profession, and really connecting that to viable solutions. We definitely have to address inequality and inequity. And again, COVID-19 has just shone a light on the major gaps in our culture and across the globe. Who has, who does not have, who has access, who does not have access, and we cannot go forward towards a positive future if we don't address that. We need to be also looking at bias, and especially bias around the environment and human health. There's a lot of bias out there of people who care about the environment, don't care about the economy. People who care about the economy are selfish and they don't care about the future of humans. We have to untangle any of those old narratives that we carry with us that block us from working with one another. We need to be looking at governance and policy, and how do we do that? Certainly unintended consequences, understanding that every single choice that we make is connected and has consequences, and be able to analyze those ahead of time. Global citizenship and global identity, recognizing that very, very quickly, just like a virus moves around the globe, attitudes can also move around the globe, both pro and con, attitudes that support a positive future and attitudes that stop a positive future. And finally, historical and current global values. This is where we need to understand, especially about people who have been marginalized and knowledge that has not been able to be allowed to come forward from other communities. So altogether, this sets us up for, again, setting our feet on a positive future. Okay, so that might have all been new to you, perhaps, but a bathtub probably is not new to you. So I'm going to be using this little metaphor for how we apply the cross-cutting principles and how we move towards a healthy future. If a bathtub is working well, it has a couple different things going on, and we need to be looking at how those things are in relationship to one another. So the faucet is pouring water into the bathtub, and the drain, if it's working well, is taking the water out of the bathtub. And those two things are work in tandem. So mitigation related to any of these issues, let's say COVID, is going to require us to slow the trickle down, to slow the flow from the faucet down. We need policy to be able to do that. We need wise governance. And that's what leveling the curve is about, is to make sure that we slow that faucet down. But at the same time, it doesn't matter if it's a trickle if our drain is plugged up. And so we need to make sure that we are adapting and that we're resilient. And that's why we're talking in the COVID time of making sure that our immunity is as strong as possible, that we're eating well, that we're sleeping well, that we're out in nature, that we're walking as much as possible, that we're getting good exercise, that we're staying hopeful, that we're connecting to others. That's about also this piece of resilience. So we need to shut the virus down, and we need to be as resilient as possible. So here's mitigation, things that we need to do with all the planetary health issues. We need to leverage scientific knowledge. So there's a lot of emerging science on how do human actions impact the oceans? How do they impact our water or our food? And it needs to be science-based. We cannot go by hearsay or trusting our gut. We need to really be thinking about what science is showing us. That is going to help us understand how to solve these issues. We also need to be making sure that our legislators are supporting planetary health policies and regulations that protect the future of the beings on this planet. So that involves voting for people who are supportive of planetary health, also making sure that we stay true to regulations that protect our environment. We need to also think about a new economic model, one that really supports actions and behaviors that move towards equity, also move towards a positive use of our natural resources, and don't destroy people and land along the way. And we need to encourage both local and global collaboration, working together on these issues. Those are all mitigation. They're all going to slow down these issues of planetary health. They're going to promote and improve health along the way. But there's also the promoting resilience, and this is making sure that we are able to stand strong in the midst of what the planet, the changes that are occurring around the planet. So that can involve practicing conscious versus conspicuous consumption. Conscious consumption means that you're very, very aware of how you're spending your money, the choices you make. And I want to take a pause to say that this particular statement is a statement related to privilege. If you do not have adequate food, if you don't have access to water, if your children don't have access to education, obviously consumption and there isn't a choice, or maybe you only have one choice. But for areas where we have more options and more choices, we want to be sure that we're choosing very consciously, choosing how we eat, choosing how we travel, choosing how we engage with nature and the environment, choosing what we teach people. If you're a faculty or a teacher, we want to be very conscious of the choices we make. And why is this such critical time now? Well, as we sort of get back to some level of opening economies and opening our society post-COVID or as COVID winds down, we also want to be realizing that some of our habits were broken during the sheltering in place. When we stayed at home, we weren't following the same habits we always followed. So as we start to come out of our homes, start to re-engage, what are the habits that we want to develop? Do we want to go back to the habits the way we were living? Do we want to choose new habits? And it's a perfect time to choose habits that support planetary health. As I said, we want to develop positive habits related to food, particularly the things that we eat, transportation, the choices we make, and the type of energy we have. Again, not everyone has options, not everyone has choices, but if we do have choices, we want to be choosing habits that support the healthiest planet possible. We want to nurture healthy relationships with others. That's very important to being resilient. That's why for some of us, when we heard social distancing, we wanted to make sure that people understood it wasn't social distancing, it's physical distancing. We need social contact right now. We need connections with one another. We need to participate in relationships that give us energy, renew our hope, and give us a sense of belonging. So it's really about developing those positive social relationships. And we need to redefine our relationship with nature. Instead of othering nature, we are part and parcel of nature. And what would that look like? And how do we support that? So really, what I'm talking about is recognizing this state of well-being. And this is from the Center for Spirituality and Healing. And you can see that everything I mentioned, health, relationships, our security, our belonging and relationships, purpose, being part of a community and environment, are part of this well-being. What I'd like to invite us to do, though, is to pivot from well-being something that is isolated and we only do on our own, to how do we also look towards planetary health, well-being, planetary resilience. What can I do as an individual or as a family or as a neighborhood or community to promote environmental health, planetary health for all? What can we do to ensure that our transportation is effective and clean, that we have access to clean energy, that we have no one is left alone, that we address biases and inequities so that people feel they belong and that they are part of the community, that we recognize the knowledge of all people and encourage the participation of all people. And this sense of purpose. If there's nothing more you take away today, it's that we are at a crucial moment in our history where we get to choose. We get to choose, are we going to choose the path that takes us really down towards extinction? We were on a path that was leading to our demise. Or are we going to take this moment to be on a path towards breaking through? Are we as a species going to evolve to a point where we understand we are absolutely interconnected with nature and the environment? We are, the health of us, the survival of us depends on the health and survival of the environment. And no person is to be excluded from this engagement. We need teachers, we need, as I said, lawyers, we need people of faith, we need people who teach yoga and meditation, we need people who teach gardening and how to can and prepare healthy foods. We need people from other traditions to be involved in sharing traditions that have led to sustainability for thousands of years. So we're at a scary point, but we're also at a point of great hope. I, for one, think we can do this. I believe we can do this, but it's important that every single person is included. So with that, I am going to open the dialogue and see if there's questions. And Molly, I will turn it over to you, and you can see if you can collate the questions a little bit.
Yes, we have quite a few questions already. One thing that I'm noticing coming out in the questions, kind of in summary, is that, it's been in the news that water and air are cleaner in certain places on the globe during this pandemic, and that some of these kind of positive outcomes from it, how do we sort of prevent from going back to where we were previously? And what are your thoughts on that? What actions do people need to take, etc.?
Well, I'm going to bring us up here. I'm very excited to see this. I've always loved this picture. So picture this. It's a field of amazing wildflowers, just the most beautiful explosion of every color you can imagine. As far as the eye can see, a carpet of wildflowers. Is that Rainier National Park? Is it, Alaska? Where is this? And it's the Mojave Desert. It was like a 1,000-year rain or 500-year rain, and all those seeds were there, and all of them came blooming. And I think that's what we're seeing with the cleaning of the air and the cleaning the water starting to get clearer, and some of the species starting to rebound a little bit. when we stop intervening. I find that not as, oh, good, that gives us permission to just start to keep going back where we were because we know that things can recover. They can't recover if we start on that path. They can't rebound or continue to survive. So we're given like a pause here to see how can we help the earth renew. We now know that it has tremendous regenerative capabilities. So the reason why I like this moment so much and what's happening as far as the impact with nature responding is that it brings us from, oh, it's a done deal. We've already destroyed the planet. There's nothing more we can do. So I'm just going to keep making the dangerous choices I'm making. It says, no, it is not a hopeless issue. Look what is possible when humans are not busy destroying the natural ecosystem. So look what's possible. Things start to renew. And can we, as humans, still have human health, still have move towards equality and equity, move towards development of all nations, while still living in a way that promotes the health of the ecosystem? I absolutely think we can.
Thank you. One participant had expressed that they found it frustrating how planetary health issues are often narrated in the media as kind of the environmentalist issue versus, everyone else. Do you have any advice on how we kind of shift that narrative?
That's a great question. Thank you for asking that, because it is a narrative. It's an old story that says that everything's fragmented, everything's discipline oriented, nations are separate, people are separate, humans, animals are separate, everything's separate. And so it creates this old story of you have to make a choice. Does this fit in this bucket or does it fit in that bucket? The thing is, we're all in the same bucket. We're all in the same pail. It's all interconnected. So that, yes, we have to shift the story. So whenever you hear somebody say, oh, that's an environmental issue, I hope that you've maybe perhaps even had some seeds of thought today that allow you to go, wait a second, it's not an environmental issue. I too care about the future of our planet. I too want to work on issues of a healthy ocean, healthy air. That's going to impact all of us. And we're all in the same system together, this interconnected system. So like a story, stories can change. That's the beauty of it, is we can choose our narrative. But we can't just sit back and let somebody tell a bad story or continue to grow the old story. We need to make a shift over to the new story that says, we're in this together, folks. We need to be working together. We need to deeply respect our relationship with nature and be in recognizing that deep interconnection. So choose the right story and pass it along.
Yeah, this is sort of aligned with that former question as well. How do we win hearts and minds and motivate people to take action? People sometimes shut down, get overwhelmed, or dismiss warnings as politically motivated.
That's a really good question. And I think we've gone down a dangerous path by attaching environment to a political viewpoint. We have to decouple those. And that was a story that was purposely told and purposely grown to say, you're in, you're out, you belong, you don't belong, we're divided. We have to keep coming back that this is not a political issue. Our survival, whether the planet survives, is not a political issue. It is a humanitarian crisis and a crisis for the rest of the ecosystem or biosphere. So we need to decouple those and say we all need to be working on this. We might have different approaches, we might have different ideas, but we're working on this together. And so how do I engage somebody that has a view different than mine? What we've found very effective is what we call a climate conversation. And a climate conversation starts out this way. And it's not duplicitous and it's not trying to lead people astray. It's just a really good conversation. And that is, try to get to know the person. Don't come in with your solutions or your attitudes or your science or your data or your talking points. Try to get to know that person. And one of the questions we found that opens the heart a little bit is, tell me a time that you've been out in nature that has touched you profoundly. And we've never found anybody who hasn't been able to come up with some moment, whether it's sitting in their backyard, it's feeling the rain on their skin, it's smelling something that's blooming in the spring. Somewhere people felt connection to nature. And you can say, and I do too. I share a common thread. I too love nature. And have you been able to see, or are you following some of the words that indicate what's happening to nature? Let me share with you a little bit of what's happening and start that dialogue. And the more that you can share local examples, the better. We found that people do not get involved or worried when you use a polar bear as the talking point. It has to be something local. So in Minnesota, we know that the boundary waters, which many of us love up in northern Minnesota, is projected to become an oak savanna. The pine trees, the boreal forests are disappearing, and it's going to be oak trees. That wakes people up when something that's close to them is shifting and changing. And so it's using those local examples. Similar also in Minnesota, I know you think we're a little crazy, but we do love our winters. Most of us that stay here love our winters, and our winters are changing. We have less snow and far more ice. So when people begin to realize, wow, this is now, and we're doing some things that are causing this, tell me how to get involved. So it's that bringing people, listening to people, respecting people, engaging people, what I would say at the heart level, and then working, invitation to work together. So great question, thank you.
Great. One participant is wondering how we can help reduce consumerism when our economy is based on that principle.
Yeah, and that's one of the reasons why I say we need to challenge our economic model. And there is some very nice work being done. There's called the Social Wealth Economic Indicator. So instead of the looking at the GDP, it's really looking at, does this support a healthy humans and healthy planet, or does this support just a healthy economy? Because as we know, and as we're seeing, a healthy economy is not healthy for all people. So it's really starting to shift, or at least question, that narrative of, do we want to move things? I would say that our economy does not need to suffer because we move in a planetary health direction. I happen to shop at, and I'm not going to say the store I shop at, but I happen to shop at a place that you can almost tell how the consumers are driving what's on the shelves. So I never would have used to seen things that support sewing, like sewing machines, scissors, things like that, would not have been there. Canning items, a lot more eco-friendly items, and certainly items that don't have trans fats anymore, or a lot of packaging. There's a lot more local produce, local products, and that's because the consumers have driven that. Now, is that company suffering? Absolutely not. Their stock is doing very well, and people are very satisfied with that company. So we as consumers can be conscious with how we spend our money, what we ask for. I've been known to, when I shop at this place, if I see something they're doing and something that I like, such as they started carrying compostable paper plates, that if you had to use a paper plate, at least it was compostable. And I went to the manager and said, I want you to know I'm so pleased you're doing this, and I will continue to shop here because you're carrying a product that's good for the planet. That didn't take me a lot of extra time. It doesn't make their company suffer because they're carrying this. It's possible for a healthy economy that nurtures the health of humans, an equitable economy, to actually bring us to a better point of the future.
Great. Do you know what practices the medical industry or medical practices could do or are doing to reduce the amount of medical related waste, such as bandages, plastics, etc.?
And that's a really good question. Healthcare is a large part of the problem, I hate to say. And so one of the things that's happening is we're becoming more conscious that it's a problem. Certainly COVID is challenging a lot of our attention right now. And so things that we're in the process of learning, how do we decrease our carbon footprint and how do we look at our purchasing, has been slowed just a little bit. But if anything, it's adding fuel to why this is so important. There are programs such as Practice Green Health and Healthcare Without Harm that are wonderful sources of information for healthcare providers and organizations on how we begin to shift our behaviors. And it's everything from purchasing and the products we use to packaging. You can still have sterile packages without so many layers, etc. So using science-based evidence on what are the best practices to have. There's now some moves to look at the anesthetic gases that are being used because we know that some contribute more to greenhouse gases than others. And so healthcare is working on this. And certainly nurses and healthcare out in the community understand that now it's much smarter to put a lot of our efforts up front, keeping our people healthy, than waiting till there's a crisis that requires intensive care and other interventions. So we're also working on tipping it more towards population health.
Great. There's actually quite a bit of idea sharing going on in the chat about different ways people kind of reduce their carbon footprint and support planetary health. And one of those is eating a plant-based diet. Can you talk a little bit about how diet is related to planetary health and what are some of the kind of fundamental guidelines of that?
Absolutely. So diet is a really important issue. Again, I want to be very sensitive that if you live in a food desert and have very few choices, that is not something that you maybe have the privilege to make choices around. But as much as possible, if we can eat locally and eat seasonally and decrease our consumption of meat. We're not saying everybody has to become a vegan or everybody has to become a vegetarian, but we are saying that we need to be moving towards decreasing our meat consumption. And that does improve the health of the planet as well as improving health of human beings. So I'm not going to quote science to you. I would direct you to Project Drawdown, which is doing amazing work on evidence-based solutions for drawing down our greenhouse gases. Project Drawdown is wonderful, wonderful science-based evidence that we can all take and learn from and follow through with. And I'm happy to say that we are now launching Nurses Drawdown, which is speaking to the global nursing community about how we get involved scaling Project Drawdown solutions. We've chosen 5 of the solutions around nutrition, so it's plant-based diet and clean burning cook stoves, around mobility, so we're looking for bikeable cities, use of mass transit, and really paying attention to our transportation. We're looking at educating girls and family planning. We're looking at clean energy and making efficient choices and efficient use of our energy. And the 5th is nature-based solution, planting trees. So we're encouraging the global nursing population to get involved in these 5 actions to help preserve the health of the planet. Not just because it's the health of the planet, but as we know, everything's interconnected. The health of the planet is also about our health. And these 5 actions are deeply, deeply connected to the history of nursing. 200 years ago, Florence Nightingale was born on May 12th, and she said, if humans have exposure to clean air, good food, a clean environment, good social connection, and nature, they're much more likely to recover well and stay healthy. Nurses know that, and we are saying the same story, but now we also know that we need to do it quickly.
Great, and I did put the link to the Project Drawdown initiative in the chat, so feel free to check that out. We are getting a little low on time here, so one final question: if someone is looking to get involved in planetary health, where would you recommend that they start?
That's great. And I hope all of you want to get involved because we're going to need all of you. But it's a positive, beautiful future that's possible when we work together. And so I would urge you to go to the Planetary Health Alliance. It's based at Harvard. And there's all sorts of resources. There's focus groups that you can become part of. There's a international conference. There are webinars. There's curriculum. There's videos. That is really the go-to place to start to get grounded in this philosophy. And then the other place I would tell you to go is go outside. Nature has so much wisdom and holds us and is wrapped around us. And as much as we have harmed it, it's coming back to say, let's work together. And so getting outside is good for our health and is good for the health of the planet.
Great. Well, thank you so much, Teddie, for sharing your expertise, and thank you all of us for, thank you to everyone rather for joining us for today's webinar. We will be sending out a post-webinar email sometime this afternoon, which will include a recording, and you're welcome to share that link widely with friends, family, colleagues, etc. It will also have a copy of Teddie's slides and some other resources that Teddie highlighted and that we have here at the Bakken Center. And finally, it will include an evaluation, and we would love to hear your thoughts and feedback regarding today's webinar. Thank you, everyone.